Someone said that teeth drifting is like a bad relationship. It's slow and gradual, but can eventually lead to a lot of pain and heartbreak. Is that right? Well, I don't know. But have you ever noticed that your teeth are moving apart? Maybe you're beginning to have a gap where none existed. Or your existing gap seems to be getting wider. Or you notice that your teeth are beginning to get crowded or overlap each other. If so, your teeth are drifting. Teeth drifting is quite common and it affects a lot of people. Today, we are going to find out why your teeth are drifting apart and what you can do about it. There are a few different reasons why teeth tend to drift. One reason is your teeth are constantly moving. The supporting structures of your teeth consist of the gum tissue, the periodontal ligaments, and your jawbone. Your teeth themselves are held onto the jawbone by the periodontal ligaments. Now, over time, with constant chewing, especially if you chew a lot of hard things, these ligaments can eventually loosen over time, which can cause your teeth to drift. This can happen due to natural aging, trauma, or even some conditions that affect the supporting structure, such as gum disease. Another reason why your teeth may be drifting is because they are trying to find a much more better position for the bite. Your upper and your lower teeth erupt until they touch each other. So if your bite is not properly aligned, your teeth may drift because they are trying to find a much more comfortable position. So what are the common causes of teeth drifting? A missing tooth or missing teeth. When you have a missing tooth, the teeth on either side of that gap will try to shift into the gap, eventually causing your teeth to drift. If you have dental malocclusion, such as crowded teeth, because there isn't enough space, your teeth can start to overlap each other, such that one tooth ends up being shifted out of position, leading to drifting. Gum disease. Gum disease is a disease condition that can affect the supporting structures of your teeth, which are the gum, the periodontal ligaments, and the jawbone. And when this gets to an advanced stage, which we call periodontal disease, it can eventually cause your teeth to drift because you no longer have any support for the teeth. Trauma. This can occur as a result of either an accident or a blow to the face. Now what happens is the teeth are pushed out of alignment because the ligaments that hold them are cut off, and this can eventually cause your teeth to drift with time. Teeth grinding, also called bruxism, is a situation that occurs where your upper and lower teeth are constantly grinding each other. Now most times this occurs at night, but can also occur during the day. When you grind your teeth aggressively, over time there can be a lot of stress applied onto your tooth, which can eventually affect the periodontal ligaments and then can cause your teeth to drift. Some bad habits like nail biting, tongue thrusting, or even thumb sucking can apply some amount of force on your teeth, which can eventually make them move out of alignment or cause them to drift. Orthodontic treatment or braces. Now once you've had braces done, whether in the form of traditional braces or Invisalign, there's something called retainers that you wear after your braces that help to keep the teeth in their new position. If you don't wear your retainers as instructed, there's always a chance that some teeth can start to drift out of alignment. Last but not the least, habits like tobacco or cigarette smoking, or even systemic diseases like diabetes, which is characterized by high blood sugar, have the tendency to affect the periodontium, which can increase the risk of developing gum disease, eventually causing your teeth to drift. When your teeth start to drift apart, you may notice some of the following symptoms. The most common being gaps between your teeth. Now it's possible that you never had a gap before and you notice that there is a gap already forming, or you had an existing gap, but over time you notice that the gap is getting wider. That means that your teeth have started drifting. You may notice that your teeth are starting to crowd or overlap each other, especially when you never had that issue before. That could also be a sign that your teeth are drifting. You may also notice that one or two teeth are becoming crooked, especially when they were initially straight. That could be a sign that your teeth are drifting. You may also experience some difficulty chewing or even talking, especially when you have a bad case of malocclusion arising from teeth drifting. You may also experience some sensitivity to hot or cold food and drinks, especially when there's associated gum recession and root exposure. So what can you do about teeth drifting? If you're concerned about your teeth that have drifted, these are a few things that you can do. First of all, see your dentist. An assessment of your teeth and your bite will be done to know the actual cause of your teeth drifting. And then treatment options can be recommended to either help stop the issue or reverse the process. If you have gum disease, you want to make sure that it is treated properly by visiting your dentist. Now, depending on the stage of gum disease, you can either have teeth cleaning done, scaling and root planing, or even periodontal gum surgery. You want to make sure that your gums are properly healed so that way you can prevent further damage. But you also want to make sure that you are practicing good oral hygiene. That means brushing and flossing as recommended. If you have a missing tooth, you want to make sure that you close the gap, either by wearing dentures, having a dental bridge made, or even having dental implants. Now you have to see your dentist so that they can recommend the best option for you. In cases where you have overcrowded teeth or crooked teeth, you want to make sure that you get them properly aligned. You can choose between traditional braces or Invisalign or clear aligners. Now, to know the best option for you, you need to seek proper advice from your dentist. If you've ever had orthodontic treatment done, please make sure that you wear your retainers as instructed to prevent a possible relapse. The retainers allow your teeth and your jaw to settle properly, thereby keeping your teeth in place. If you grind your teeth, you need to stop grinding. Or if you can't, you may want to consider getting a mouth guard or a night guard fabricated for you. This helps to protect your teeth from further wear, thereby preventing teeth drifting. Also, avoid tobacco smoking or cigarette smoking. And if you have diabetes, try to make sure that your blood sugar is controlled by taking your medications as instructed and also by eating healthy, which is most important. So if your teeth have drifted apart and you don't like the way they look, there are some things that you can actually do to fix it. Just make sure to visit your dentist for proper advice and recommendations. With that, we've come to the end of this video. Thanks for watching, and I hope that you learned something new. Please like, share, subscribe, and turn on your post notification. That way you get notified when I post new videos, and I will see you in the next one.